All right. Hi, everyone. So I'm doing the continuation of the lung channel series here and trying to do it at the same time on live Instagram and YouTube channel. People sign up for it, and hopefully this is the best way to spread the word. Let's see. So I'm Katya, and I'm from New Orleans, and I'm an acupuncturist and a mover, and I've been putting out the videos about the lung channel, uh, just kind of synthesis of different ideas from Chinese medicine perspective and philosophy um, perspective of. This is really hard to talk in front of the Zoom, so excuse me if I'm a little convoluted. But you get what I mean, and I think that I'm just gonna jump back into continuing the material from the last time. We traced the lung channel. We talked about the lung channel, and you can try to find those videos on this YouTube channel or my YouTube channel, Katya Chizhaeva. Uh, and so we trace the lung channel. It starts in the stomach. It comes up here under the clavicles. It passes internally through the heart and the stomach and the large intestine. And it continues down the internal side of the arm into through this particular point from which we're going to start today. This is lung 7, Li Chu. And then it kind of goes into here again. This is lung 10. This is lung 7, lung 8, lung 9, lung 10, and at the end, at the corner of the thumb, lung 11. And these are all numbers that the English speaking people assign to those points. They have this beautiful, poetic, and very meaningful names in Mandarin, but um, right now we're just going to look at the superficial information. Um, and then there is a little branch from the lichu, and it goes to the index finger, to this finger, to the index finger, and to the corner of the um, nail. Um, so and it goes through large intestine 4 and into the large intestine channel, large intestine 1. Uh, so, okay, I hope that was clear. And so this is kind of the anatomy of the channel, of the lung channel. Um, so what's interesting about lung 7 is that lung 7 is a Lowell point. Lowell points deal with accumulations, physical as well as emotional. I mean, emotional is both physical as well. Um, but it's specifically a point that addresses kind of an accumulations that are phlegm and dampness and regulates water. This point regulates water passages and sweating in the body. It also regulates emotions, so especially connected to the lung system, which carries grief and sadness. According to Chinese medicine, it's connected to the soul that is called Po. There's 5 different souls in the body, and the one in the lung is called Po, and the Po is associated with ghosts and the color white. Although the lung channel and organ are both associated with the metal element. So Chinese medicine is about elements, uh, elementary philosophy about the world, very similar to the Native American belief system here or European pagan systems. But in the Chinese tradition, there is 5 elements. So one of them is metal or air. So it's kind of metal air. It shares a lot of similarities with air. It includes air. Um, so the other ones are water, fire, and earth. So the metal air is connected to the season that is the fall. So each element is connected to different season, and in the fall, the organ to which the season is assigned is actually weakened. So in the fall, the lung is weakened. The dry wind comes from the north, especially in some parts of China. The weather changes, and the lung is exposed to dryness, and and so there's mm, a lot of people getting sick, uh, or at least traditionally that's been kind of like what's been observed. Uh, so uh, yeah, so the element we're working with the metal element or air element of the lung, and it's obvious why it's connected to the air because we inhale and exhale. Um, so the lung seven is about can help us to open up the chest. And if you're using acupressure, so the point is located if there's this bone, it's protuberance. If you kind of bend your arm, there will be this bone right here. And if your finger is on the bone, it's going to go right under. And there is this kind of a cave or split right under the bone. And this is the point. So you can work with it with acupressure. You can gua sha it, scrape it. If you're dealing with releasing heat or you're trying to make sweat happen or release some, um, like this is a great point for things that are like hay fever and hives and sudden heat in the face or allergies, for example. Um, and usually I've been looking at the a book source just to kind of, and I know reading is kind of hard, reading the book and then the Zoom, but this is kind of very helpful just to reference. So this book is Dadman, Peter Dadman, very standard acupuncture text. And it says that lung seven, um, let's see, benefits the head. It helps the phlegm and inflammation. It regulates the water passages, as I said. So water passages. We can come back to it in a second. Um, let's see. So, and symptom wise, it will be chosen fever, nasal congestion, coughs, wheezing, asthma, dyspnea. Many of the points on the lung channel are all helpful for this kind of symptomology. Then also headaches and stiffness of the neck, one-sided headaches, toothaches, even just because we have a connection to the large intestine channel. Um, and then lower channels are those kind of bridges between the yin and the yang pairs. And so the yin and the yang pair here is lung and large intestine. The yin organ is lung, and because it's a full organ, it's considered dense organ, and the yang organs are hollow. So in this case, it's large intestine. Okay, uh, let's see. It's also an interesting side note. It's a useful point in women who are pregnant who have this nonstop nausea with a lot of saliva coming from the mouth. So just thrown out there, I saw it being really useful with a patient I had. Um, so difficult urination, painful urination, um, and then pain in the genitals. So there is a certain kind of connection at this point has to urination. So it's a good thing to remember that if you're working with symptoms where a person symptom is painful urination or difficult urination. Uh, okay, so this is good. So the name of the poem is a broken sequence, just and it's a cool kind of side note because the leech is a broken sequence because the channel goes up here, it goes this way, and it goes on the inside of the arm, and then it breaks to the outside of the arm to this bone protuberance and kind of goes through here and then pops back uh, here actually to lung 8 and then lung 9 and goes up the thumb. Um, okay. All right. So I don't want to read the commentary because it's too much. Yeah. So moving on. Then we have from here, line 7, we have line 8. We're going to skip that point, and we're just going to go to line 9. And line 9, if you bend your wrist here, you will see that there is a crease. And so the line 9 point is right at the crease on, right on, before the tendon. There's a tendon here that you can feel or see, and it's right before the tendon at the crease. So line 9 is a really important point. It's a tonifying point. So if previously we were discussing points that were specifically for access conditions, for conditions that are acute, there's a lot of phlegm. It just happened and it's been happening for a few weeks, but it's one of those accumulations. You have a lot of phlegm, sputum, cough, so things like that. But this point is specific for chronic conditions that's been going on for a long time, or for someone who just has a very low immune system, either due to the suppressed immunity or due to old age, or because they were chronic smoker or are chronic smoker, or they have other pre-existing health conditions that have weakened their constitution and qi. So lung 9 is one of the most important points to tonify the qi in the body, and specifically the lung qi, but overall the whole qi of the body. So by tonifying the body's qi, the end result of it would be that the person would feel a little bit more energetic after your connection to this point. So I recommend, if you do work with energy work or body work, that you are spending longer period of time on this point, and you really pay a lot of attention to this point and in a slow way. You can use circles towards the midline, very tiny circles with your thumb. You can use, it could be energetic. You can just hold the point and kind of feel you will feel the pulse because that's where the pulse is felt. Uh, but and I wouldn't compress the pulse. You just kind of want to think in and tonifying rather than pulling things out and releasing. So that's how you work with this point. So I'm gonna again pick up the book and see what it has to say. So the name of the point is Tai Yuan, and it's Supreme Abyss, the translation. Um, and so it's interesting. It's Yuan point, the first lung 1 point on the channel is a Mu point. And the Mu points especially helpful with conditions that are excessive and acute, and are when there is accumulations. So specifically here in the lung system. But the yuan points are tapping into the deeper energy flow of the channel or of the body. They're tapped into the organ level. And so not all points do that. And the yuan points are the ones that do that. So working with yuan points on all the channels helps to tonify the organ, the body. Let's see. So let's see. So the indication, the actions of the Tai Yuan, it tonifies the lung. It helps with the phlegm. It promotes the descending function of the lung. It regulates and harmonizes all the vessels. So it's considered the Hui meeting point of the vessels. So what that mm, might mean is that it's helpful in increasing cardiovascular flow in the body. So here by vessels, they mean the whole cardiovascular vessel system. Um, okay, and so the indications are cough with watery phlegm, asthma, wheezing, shortness of breath, hot palms, dry throat, oppression and agitation in the chest with difficult breathing, and inability to lie down. Uh, there's also coughing blood, spitting blood, and it's that connection to the vessels again. Uh, there is also rebellion, stomach chi, belching, uh, but we cold shivering and toothaches and swellings in the face. Um, so that's where I'm gonna leave it at. Let's see. So then we're gonna move on to lung 10. So this was lung 9, and this is lung 10. Lung 10 is located. So lung 10, it's called UG, and it's translated as fish border. And so the location is on the border of the bone. That this is the bone of my arm, hand. So, and if I go around the bone right here, right in the middle, is lung 10. And the official location is on the thinner eminence of the hand in depression between the midpoint of the shaft of the first metacarpal bone and the thinner muscle. Okay? Um, so the point is a fire point. So all the different points, and I'm sorry I'm haphazardly coming to explain all these things, but so because there's 5 elements, the points that are below from the elbow and up are divided into 5 categories, and the same thing happens from the knee down on the channels that are on the legs. And so all the points are divided by the elements that they belong to, and supposedly they have a connection to that element. So this point is connected to the fire element, and the lung 9, for example, is connected to the earth element, hence the connection to the belly and the vomiting side note. So this one is the fire point on the lung channel. And so this is a point that's famous for treating a lot of very hot symptoms. So very sore throat, something is very inflamed, the lungs are inflamed, any kind of facial inflammation from conjunctivitis to kind of eruptions on the face, toothaches, skin problems on the face, and also hot and dry sensation in the lung, in the throat, in the nose, is what this point is indicated. And again, in this case, we want to release the fire. We don't want to tonify. We want to release because it's an excess conditions normally. And so with this point, I would think about releasing. If you're gua sha is a term for scraping. So if you're scraping out towards the thumb, and you're pulling, or if you're using very gentle type of work, then just you're trying to think out rather than in, or you're trying to clear the heat. So there's the work with that information how you do, but normally, but this would be the difference of working with this point. Clinically, I found this is very useful. It releases a lot of heat for the people if it's needled, and even shaking it and kind of pulling out and kind of working on the meat of the muscle here, and really releases a lot of uh, s- symptoms that are connected to heat sensations. Um, let's see. So this one is very famous for like swollen, painful throat, and it could be sore throat, could be dry throat, could be loss of voice, could be a cough with absence of sweating, or a cough that's leading to sacral pain. So if you're coughing and then your bones in your lower back starting to hurt, that could be a great point. Um, Shortness of breath with heart painful obstruction. So it's because the point is a fire point and the channel goes through the heart, which is a fire element. And so there's that connection uh, from the channel perspective. Um, Coughing blood again. And then agitation of the heart, sadness and fear, anger and mania, sadness and anger, um, painful heart obstruction with fear and fright. Um, so, yeah, I mean, this is all compilation of a bunch of different sources. So, but basically, that what they're saying is that if a person is really agitated and anxious or overwhelmed with strong emotions, uh, lung 10 is a great point to work with. And also, they're giving kind of like a little bit of a tongue pulse diagnosis. So the tongue would be yellow, perhaps it will have a yellow coat, it will have a red tip, which indicates heat signs. And the pulse might be wiry for those who take pulses, wiry and long, and very strong, rapid pulse. So that would indicate that there's a lot of heat in the body. Let's see. Yeah. So, and we're gonna come to the end of the lung channel. This point at the tip of the nail. Um, you wanna kind of, one of my teachers just so officially the point ends at this side of the channel, but you kind of want to pluck the nail on both sides or the skin around the nail and see which point becomes more redder. And so, and then traditionally this point was slightly pricked. And in my practice, I use like diabetic lancets, and I have this little tool that I set on a very small kind of like level, so it's not painful when I do it, and it's a very tiny laceration. But traditionally, this point is bled for any kind of pain along the channel, as well as um, So we're going to go over the symptoms, but it's considered a very strong channel opening point and releasing. So it releases a lot of heat and stagnation. But it's also tricky. And the way that you can do it for self care, you can kind of press on the point, which is right on the side of a nail. You can kind of pluck it. Again, this point mostly is used for access conditions. Sometimes some people use it to tonify the lung channel. Um, that is when a person is very cold, something is very chronic, the condition, like I'm thinking in the past, it would be like TB or something that where a person is very deficient, and that's when this point was moxed or warmed um, uh, by um, by moxa stick. But in most cases, this point is to be released. Um, so the point's name is Shao Sheng, and it's meant it's translated as lesser Sheng. Um, it's a wood point, so it's connected to the liver. Channel element. So the wood element is connected to the liver channel. So, and this point is connected to the wood element. It's a wood point on the lung channel. Um, and it's also uh, a ghost point. So, and that's a separate discussion. But just like a little side reference, there was a famous doctor called Sun Miao, and he came up with a ghost exorcism protocol. And in some circles uh, uh, of acupuncturists, it's still, these protocols are still being used for mental health issues, not so much for exorcisms, but for different symptoms connected to mania, depression, and strong anxiety, and so forth. Um, so, um, so the point is also in the category of Jane Well. So another side note, there's 5 categories according to the elements, but there's also 5 categories according to uh, the body of water. So starting from lung 5, which is a Hasi point, it's related to the sea, and then Li Chu, the lung 7 is Yin Spring point, and so, and there is a river point. I think it's along 10, but basically it ends with Gene Well. So there's 5 categories, and they're trying to describe the how the fluids flow from the bigger area down to the estuary, from the sea to the estuary to the spring, to the river, to the spring, to the well. And so this is kind of the the language um, for the circulation within the channel, but also kind of throughout the arm. So this is Jinwell point. So let's see. So indication. So it is indicated for let's see, sore throats. Uh, and especially if there is like very very strong strong, if there is a lot of inflammation in the throat, is definitely the point to use. You want to release the heat as much as possible. um, so the dry lips and desire to drink, if there is a fever and with cold shivering, um, if there is cough and the feeling of anxiety and agitation, the fullness of the heart with sweating. Um, yeah. And that's kind of, I mean, I'm leaving a few different things, but basically, this point is to clear stagnation, to clear the heat from the channels. Okay, I think this is good. So I so far we covered the lung one, we covered lung three, lung five, lung seven, lung 9, lung 10, and lung 11. And then there is a little branch that goes to large intestine 1. And we can finish here with large intestine 1, which is at the corner of the nail. And then the large intestine is going to go up the index finger and through the hand, and it's going to be on the external part of the arm, on the yang part of the arm. So the internal part of the arm is called yin side, and the external part of the arm is called the yang side. And the yin channels are located on the inside of the arm as well as the legs, and the yang channels are connected on the yang sides of the body. And this is not arbitrary, this is connected to the way that we've developed embryologically. And maybe I'll talk about it later in the next post, but it's not an arbitrary kind of descriptions. These have a lot of different connections that manifest in our posture, or in the way that we've, developmental patterns of movement, and in the way that how our body even developed from the internally and externally, from the backside to the front. So, so very interesting stuff to geek out on. So, but yeah, large intestine one. Large intestine one is uh, it's getting dark here, so I can't read anymore. But basically, it's the beginning point on the large intestine channel, which ends right here. So, which ends on the other side, on the opposite side of the nostril. So, if we're looking at the channel on this side, which is my left, it will end on the opposite side, crosses the side, and on the side of the nostril, right here, will be large intestine 20. And so this is a great point to release any kind of congestion in the that's connected to the nose. So even though we say large intestine, a lot of the symptoms that are connected to that channel is actually the symptoms that we traditionally in the Western world connect to the respiratory system. So, and again, this is a fire point. I mean, sorry, the gene well point. So it's a point that releases a lot of stagnation and pain, painful obstruction along the channel. And we'll go over the channel, but any obstructions in the nasal cavities or sinuses are also connected to the channel. Okay, so thank you for listening. I'm going to continue to post these videos at least once a week. And I'm going to start a Zoom study group of Chinese medicine. It will be on Sundays here. I think it's Central Time here, New Orleans. And I'm thinking of doing it from 1 to 2 p.m. So if you're interested, I'll post it on my website, librewellness.com, and my Facebook and Instagram. And I can send you the Zoom link once you sign up. But it's going to be kind of like a live discussion. I'm going to cover point locations, also theory, like 5 elements, but also other stuff. And I want to kind of towards the and get into the qigong aspects of this theory, and kind of try to do just a few a few qigong exercises towards the end to kind of get in the body and experience more in the embodied sense how this um, how this can be used in terms of sensing those points or channels um, and working internally with the information, not just by external body work or energy work on somebody else or even on yourself. So, but working a little bit more with the energetics of the Chinese medicine theory. Um, okay. Thank you so much and have a beautiful evening. Bye. See you.